It's been exactly 3 months since the very first case of COVID-19 was reported in the U.S. Public health authorities say the man from Snohomish County was successfully treated at Providence Regional Medical Center in Everett. Under a compassionate use protocol, the COVID-19 patient was given Remdesivir.
This is a experimental drug. We know it was developed by Gilead for Ebola.
Information about his care and remarkable recovery were published in the New England Journal of Medicine. Providence is now involved in 2 clinical trials to test the antiviral drug.
I think this drug is going to help the treatment part.
Dr. Vinay Malhotra of Multicare Institute Research and Innovation based in Tacoma says the experimental drug is promising. His hospital is part of 2 clinical trials. 40 patients have been treated with the antiviral drug. 32 patients were in severe condition, 8 were in moderate condition. Of the patients treated, 17 of them have already been discharged.
We've been able to see improvements and discharges on these patients, from ventilated patients, from prone ventilation, from almost going to palliative care and coming back. And that's a big change.
At Evergreen Health in Kirkland, a clinical trial is also underway. 32 patients were treated with a drug or placebo. 29 of them were in severe condition, 3 were in moderate condition. Of those treated, 21 have gone home. KOMO News asked Evergreen Health what they thought about the drug and the results so far.
We won't know till the middle of May, but we're all very cautiously optimistic. We hope that it is working.
This is one of the things that's going to provide clarity in treatment. So people should be hopeful.
We're going to take steps and then monitor to see whether they work or if we must continue to adapt. We will not be able to lift many of the restrictions by May 4th, and we will let you know when we can lift those restrictions just as soon as we know. You know, Washington's likely decline in the spread of COVID-19 is encouraging. In the coming days, we will receive additional health modeling projecting the course of this virus. And we hope it will give us cause to begin lifting certain restrictions.
As we reported to you last Friday, the State Hospital Association says they really need to get going again with elective surgery since the surge of COVID patients didn't materialize. Well, tonight, the governor said he agrees they should start soon. And the same is true for the construction industry. He says industry leaders have come up with a multi-part plan on how to bring people back to the job sites and do it safely with social separation. It's something that really has been a sticking point for people, especially those stuck home. The possibility of allowing outdoor recreation, a chance to take advantage of all that Washington has to offer. He didn't give a timeline for all of this, but the May 4th deadline, he says some of these things may happen prior to that. They'll ease it in, and he says, though, this is going to be with us for a long time.
Producing medical face shields was born out of care of community at Everett's Flute Corporation.
Basically, anybody who needs something, we're trying to get it in their hands.
The company that also produces industrial equipment has delivered more than 10,000 face shields to hospitals and senior care facilities across the state. And they aren't the only ones. 65 Washington manufacturers have answered Governor Inslee's call to action.
Every one of these companies that has stepped up is not only doing something to contribute to our public health and safety, they are contributing to the economic vitality of their community as well.
Businesses making items like masks, face shields, gowns, hand sanitizer, and more.
Do you believe these items will help fill the gaps in the supply chain?
To the extent that we can build the supply chain and build the production here in Washington State, it will naturally start to serve the private sector and community needs that we have.
But it will take some time. The state says as of today, they've ordered more than 256 million items of PPE. That's compared to 10 million items ordered in late March. So far, about 12 million pieces have been delivered, with supplies arriving every day. So are these items meeting demand? Consider this. There are 4 tiers that are prioritized for allocation of PPE. Right now, items are still only being supplied to the first tier. So in the meantime, some of Washington's businesses are doing their best to fill the great need.
We hope to be able to increase or even double those numbers in the coming weeks.
Many of you haven't forgotten about the $30 car tab initiative. Bob Andrews reminded me on Twitter asking, I know everything now is about the virus, but what about the $30 car tabs? I've been trying to find out if they're $30 now or I have 2 cars due in May and they're both over $200. So to Paula May, who emailed us, what about our $30 car tabs we voted for? Can we get relief? So here's the deal. According to this notice from the State Department of Licensing, a King County Superior Court order is still upholding the injunction stopping $30 car tabs to go into effect. The case has now been appealed to the Washington State Supreme Court. This means Department of Licensing will continue to collect all vehicle fees and taxes unless directed by the court to do otherwise. I talked to initiative sponsor Tim Eyman about it.
People have every right to be extremely frustrated. I mean, here's an initiative that ended up qualifying for the ballot, passes overwhelmingly, has a King County judge uphold it as constitutional, yet it's still on hold.
Which leads to this question I got from Clarice Jacobs. I was wondering if you know about car tabs that are due in May and June, if they're pushing back the payments on that, or if they're still going to be due on time. DOL leaders sent me this email saying it would take a change in the law to lower or delay vehicle renewal payments. Officials say tabs are renewable online, by mail, and many vehicle licensing offices are open, so people who have to drive are advised to keep tabs current by law.